Hi.
Hi.
How are you doing today?
Great.
Good. Let me close that door. Oh, let me close that door for privacy. My name's Terry. I'm going to be your nurse today, and I'm going to be taking care of you. You're going to be doing a head-to-toe assessment on you, and there's no way to raise the bed on this side. There should be. Your beds will have that. You have an IV today, but first, let me see. Can you tell me your name and date of birth?
Amber Bonking, 4/24/1987.
That's great. That matches my chart. Can you tell me, do you have any allergies?
No.
That's great. I'm going to check your IV first. Does that hurt? Is that giving you any trouble?
No.
Good. And according to my chart, you've got normal saline, and it's going at 50 milliliters an hour, so that is just great. And I'll set my chart aside. Tell me, during this, I'm going to ask you a number of questions. Do you know where you are today?
Yes.
Where are you?
I am at UTA campus.
Do you know what the date is?
It is October the 4th, 2017.
The day of the week?
It is Wednesday.
You are very, very good. You know approximately what time it is? Oh, approximately. Think about
or
it.
less than 2 o'clock. So
Because we leave it to,
1:30
okay,
PM.
that sounds great. All right, today I want you, smile for me. You've got a great big smile. It's nice and it's symmetrical on both sides. Can you tell me how many fingers I have up?
You have 4.
All right, so you could see my fingers and you could hear my question, and so you answered it. I want you to put your finger on one side of the nose. Breathe, close it off, breathe on the other side, in and out, and do the same thing on the other side, in and out. That sounds great. All right, let's see what else I want to do. I want to reach in here and I want to get my tongue depressor out. And my flashlight, because I gotta have that. So would you open wide for me, please? Oh, yes. And I'm looking side to side. Raise your tongue up and put it down. All right. Your mucous membranes are moist and pink, and I didn't see any signs of lesions. You were oriented towards everything, so far, so good. Tell me this. Do you have any pain today?
No.
I'm going to rephrase it. On a scale of 0 to 10, with 0 being no pain and 10 being the most pain, how would you rate your pain today?
0.
Well, that's good. I can see that you're calm and smiling and don't appear to be having any signs of distress, so that's a good thing. Now, as I start the physical part of the exam, I'm going to listen to your lungs first. And when I ask you, I'm cleaning the stethoscope all over. And when I place my stethoscope, if you will breathe in and out nice and deep, okay?
Okay.
In and out. Good. You got to be careful. Hold it for the full time. Full respiration, in and out.
Do you ask them to breathe through your mouth?
Yes, that's fine.
Just mouth?
You're doing great.
Okay.
Tell me if you get tired of breathing.
Okay.
I'm going to go under it down here. Here we go. And because this is, I am not going to go scope to skin because this is a video, in and out. But you will be going scope to skin or you lose all the points. Great. I'm going to do your sides. Again. Sounds great. I'm going to come to the other side. Go onto this side. Thank you. You're great. In and out. Good lungs. I heard some bowel sounds there too. Would you sit up for me? You'll listen to your back. Okay. Don't listen over bone. Not over the scapula, not over the spinal column. not over close. Sorry, you're gonna have to do that over again. I didn't get there in time. One more. I bet you're tired of that. Lay back down for me. I'm going to listen to your heart now, so just relax and breathe normally, okay? Remember that I'm not showing all you people on the camera any skin. All right, so I'm coming over the sternal notch, finding my location. Just lay there and breathe naturally. All right, come under. I'm going to listen with my bell now. I'm turning it over, flipping it, turning it. I wasn't a very good reporter there, so I'm going to pick up everything again. Your lungs were clear to auscultation, anterior, posterior, and lateral. I didn't hear any adventitious sounds at all. Your heart, I heard S1 loudest at the apex, S2 loudest at the base. I didn't hear any extra heart sounds or murmurs, and your heart rate was, the rhythm was regular rhythm. Now I'm going to do your abdomen now. I know we haven't done this in class yet, but what you'll expose their abdomen so you can see all four quadrants. You're going to learn this all next week, okay? But I'm going to go through the steps even though you can't see on the bare abdomen, okay? Do you have any abdominal pain at all?
No.
That's great. Okay, the first thing I'm going to do is I'm going to take my flashlight and I'm going to inspect the abdomen. I get down low, I look, I'm looking for pulsations, or any kind of bulging or hernia-like type things, any non-symmetrical things. Everything looks fine right now. I'm going to auscultate. I'm going to turn this back to my diaphragm in all four quadrants. And as soon as I hear something, some sounds gurgling, I can move on. I would say that your bowel sounds today are normal, active, all four quadrants. Would you flex your knees just a little bit for me? Okay. Now the first thing I'm going to do is I'm going to percuss. We'll show you how to do this next week. Ooh, very nice. Tympanic sounds in all four quadrants, and I'm going to just palpate, touch lightly, okay? Any tenderness or pain? Good. All right, sounds great. So your abdomen is soft and non-distended. I'm going to raise the head of your bed up just a little bit more now, and I can see that your upper body, I'm going to look at your skin, your upper body is light tan, evenly colored. I'm going to go ahead, do you mind if I'm going to pull this down? And legs, lower extremities, exactly the same. I'm going to touch you. For temperature, warm overall body, warm bilateral, and evenly colored light tan all the way down. I'm going to check your pulses. Never use your thumbs. And I would grade your pulses 2+ out of 3+ by lad. I'd like for you to just mimic my motion. Stretch your arms straight out and over and back this way. Up as far as you can, out, back up, and just I want you to push against me, all right? And pull back. Muscle strength 5 out of 5. The other way to test muscle strength is to squeeze my hands. Squeeze them hard. Muscle strength, 5 out of 5. You can do either of those motions with that. I want to try cap refill. No fingernail polish. So good. Following regulations there. So cap refill, less than 2 seconds times 10. On your legs, I'm going to check for edema. Going to press down here on the ankles for about 5 seconds. Don't see any edema there, but if there was, I would measure it with a centimeter ruler, okay? I'm going to check your pulses. Oh, I was lucky with that one. Okay, I got to think about this one. Okay, so pedal pulses, 2+ out of 3+ bilateral. Cap refill, oh my gracious, toenail polish. Gonna have to use the tips. Okay, cap refill, less than 2 seconds times 10. I want you to press against my hands, all right, and I want you to pull back against. So that's one way to do muscle strength. 5 out of 5 with that one. The other way to do it is, could you swing to the side of the bed for me? Scoot a little closer. Stretch your legs all the way out straight. Like straight like that. And then pull them back underneath as far as you can. Okay, well that was pretty good. Okay, so your range of motion is good. You had full range of motion on your upper arms as well. Bilateral, push against me, all right, and pull back. Okay, so muscle strength, 5 out of 5 bilateral on your lower legs.
Okay.
I'm gonna let you lay back in bed. I am thinking of anything I might have forgotten. Oh, on your color. I meant to say that I didn't see any signs of pallor or jaundice or anything abnormal in your coloration. I'm still thinking. Did that. All right, I'm done. Did I forget something at the very beginning? I went out of order on coming into the room. I washed my hands.